Welcome back to Active Chiropractic, guys, and today I want to show you some muscle release techniques for the iliopsoas. Now the iliopsoas is attached from the lumbar spine to the front of the hip. It's also known as a hip flexor. Now if you do a lot of sitting, or you have poor posture, even low back pain, if you came out of surgery for your hip or your lower back, or you do a lot of running and kicking, this muscle can get tight. Now it can cause a lot of pain, and it can cause you to have bad posture as well. It causes you to have anterior hip tilt and this thing called distal cross syndrome. So these muscle techniques will definitely help you. The psoas muscle is located 2 inches away from the belly button and towards the iliac crest, which is your hip bone. Just place the lacrosse ball there and lay on top of it. Keep in mind that this can be quite painful. Hold this position for about 30 seconds or 8 long breaths so the muscle releases. If you're still not feeling the tender spot and you want to add a little bit more pressure, just lift up your leg, and this creates hip extension and pushes your body onto the ball. You can add some muscle stripping or some massage by moving your legs from side to side. Place the ball on the psoas muscle, but now use a weight and place it on top of the ball. The weight will add more pressure on the tight spot. Choose the weight appropriately, just enough so you can feel a little bit uncomfortable. Otherwise it can be quite painful. What's great about this position is your body is a lot more relaxed and your muscles have the ability to be released much more easier. You can hold this position for about 30 seconds or 8 long breaths. And just like the technique before, you can grind away the adhesions and the trigger points in that area. Do about 20 to 30 strokes 3 to 4 times. Now if you don't have a lacrosse ball at home, you can use a cricket ball or a hockey ball, but if you don't have one, you can use a weighted plate and place that on the psoas muscle instead. And once again, just hold it on top of the psoas muscle in that spot for 30 to 60 seconds or 8 long breaths. The deep breathing techniques are a lot better to release muscles. Another really effective technique is called myofascial release, but this one is specifically for the psoas muscle. To perform this, just place a weight onto your muscle and then lift your leg up nice and straight and then externally rotate your leg out and then lower it down nice and slowly. Do this about 8 to 10 times, 3 to 4 sets. You can also do this with the dumbbell and lacrosse ball, or any types of techniques that add pressure onto the psoas muscle while you're lying on your back. It all comes down to what you prefer. There's other ways to release this muscle in a similar fashion. Here I'm using a massage stick. You can get these from eBay or Amazon. I looped a power band around my back and attached it to the stick, and it creates pressure onto my psoas. I have to admit, this is the most intense one out of all of them. I hold this position for about 30 seconds to a minute. Do that about 3 to 4 sets. And of course you can do the myofascial release technique as well. Now for the stretches. This is a basic stretch that I teach almost all my patients in clinic that have hip tightness. Just lunge forward and start off with all your joints at 90 degrees. And then make sure you're staying nice and straight and upright. When you squeeze your glutes in this position, it pushes the hip forward and creates hip extension and putting the psoas in a stretch position. To increase the stretch on the psoas muscle, just lean a little bit more forward. You can hold this position for about 30 seconds to a minute, or to enhance the stretch, you can raise your arm up and lean to the opposite side, away from the stretched leg. Once again, by using a deep breathing technique, you can release the muscle a lot more better in a relaxed manner. I would also like to add this stretch that I learned from yoga a few weeks ago. Instead of raising one arm up, raise both arms to your side and rotate away from the stretching leg. This will ensure hip extension and maintain the stretch position for the psoas muscle, which is the hip flexor. Now to increase the stretch a little bit better, just rotate to the side and grab onto your other thigh and pull yourself over. Now you can hold this position for about 30 seconds to a minute, or do about 8 deep breaths. Power band assisted stretches. Now I've done this video once before, but I'll show it again. This is an assisted stretch that I find works best for me. You loop the power band around an anchor point. I'm using a pole right here. Then you step away from the pole, so the power band has some sort of tension. I'll loop the power band around the thigh that I'm trying to stretch. Then I'll go into lunge positions like the previous techniques that I did before. Just start off with 90 degrees first, and if you want to increase the stretch, just lean forward a little bit. The tension of the power band pushes the hip forward into hip extension and enhances the stretch in a relaxed manner. What's great about this technique is you don't have to squeeze your glutes and your body is in a relaxed position, and the power band just pushes you and eases you into stretch. Since this is still in the lunge position, you can apply the same techniques and principles that were shown in the previous stretches. For example, raising your arm out and leaning away from the stretched leg, or raising both arms up and rotating away from the stretched leg, and holding onto the opposite thigh and allowing that to stretch through. Once again, hold the stretch for about 30 seconds to a minute, or you can do 8 long deep breaths, about 3 to 4 sets. Guys, if you do have pelvic tilt issues, check out my posterior tilt video, or even check out my SIJ joint mobilization video, because the SIJ joint is actually attached to your pelvis. Now remember to support my channel, hit subscribe, hit like, comment below and tell me what else you want to see in the future. And I'll see you guys in the next one.